Many times we need to step back, find out what their priorities are. And if it's something we can help them with to clear it off their plate so they can listen to us, then we need to do that.
Hi everyone, welcome to another episode of Operator Insights. My name is Julie Roberts, and today with me I have Sonja Racke, Regional Clinical Documentation Manager for Ensemble Health Partners. Welcome.
Thank you very much.
So Sonja, we've talked about clinical documentation prior on a separate episode, and what I want to talk about today is really give the group a refresh. So tell me a little bit about what clinical documentation improvement does.
Well, in a nutshell, we are really the group that bridges the gap between what a physician writes and what coding can put on a claim to bill to a payer. We bridge that gap by taking what the doctor writes, finding where clarifications are needing or if anything was missed, and then working with the physicians to get the chart completely correct for what was done to that patient. So coding can then code it and we're paid appropriately.
Well, that's really important to make sure that we get the bills out the door. Tell me a little bit about what you think are some qualities that are needed to do this type of work.
A nursing background, first off. You need to be a nurse. You have to have some critical care experience or some good medical surgical experience because we need to know anatomy and physiology. We need to know a lot of the medical terms and kind of how a physician thinks. So we need to be able to approach doctors and talk to them as well.
Yeah, when I hear you say that, I think of it's so important to build relationships in this space. Tell me a little bit about how you teach people or train nurses that are coming in to work for you to start to build those relationships.
I think the key, because of where we work and what we're doing, is finding how the new people learn best, because a lot of it is remote now. So we're doing remote training, we're doing on-site training, we're doing face-to-face training, and it's really nice when you have somebody new to take them up to the floor, introduce them directly to the physicians, get that face-to-face contact, because we all know with COVID, you just can't build the relationships over a Zoom meeting or over a web meeting or over the phone. You need to build them face-to-face so that you actually gain the trust of the physicians and gain the respect.
Yeah, when I hear you say that also, I think you touched on trust and respect. Can you give us an example, just an anecdotal or a personal experience that you've had in building trust with physicians and to get a positive outcome for the work that you're doing in clinical documentation?
Sure. One of my sites that's local to Cincinnati, when CDI rolled out some new software, it was software that helped the physicians answer these questions for us. So it didn't take time, didn't take a lot of working through the chart like it used to for them to find the answers to the questions. We went site to site and tried to roll out this new software face-to-face with the doctors. Well, Dr. Smith came in and I actually found him in the hallway and I said, "Hey, Dr. Smith, we need to talk to you about this new software we're using." Now, a little bit of background. Dr. Smith never answered any of our questions, never. He refused to. He would let them go and he had a horrible response rate because he never answered. We were really hoping that he would get on board with this software and it would change things for him. Well, as soon as I approached him and started talking to him about it, he said, "I don't have time for this." And I said, "Okay, when can I make a time to talk to you about this? It's really important, it's to help you." And he kind of shook his head and he said, "I'm really frustrated about what's going on at my office. I'm not getting paid at my office, and this is so low on the totem pole that I don't have the time for this right now." And knowing that Ensemble actually does our physician billing as well, I kind of stepped back for a minute and took my agenda out of the picture and realized he may not be answering these because he's already frustrated. There's so many other things on his plate. So I asked him, I said, "What's going on that you're not getting your revenue to the doctor's office?" And he said, "Something with my billing, something with my charts. I do mostly Medicare, something with some hold, and I'm not getting revenue. I can't pay people. So until I get that fixed, I'm not doing anything else." And I said, okay, well, let me see if I can help you with that. I am Ensemble as well, as is your billing company. And I like to think of this as our all for one, one for all moment. And I said, let me see what I can do. Let me take this back to the office. My supervisor and I will make some contacts, and let's see what's really going on. And he kind of looked at me and said, "You would do that for me?" I said, "Absolutely. There's a problem. We need to understand what it is. If nothing else, maybe I can find you the reason why this is happening." So he gave me his email address, and I went on my way, went down to the office, started exploring all the different avenues of who could I contact, what's the issue, where the questions are, when all of a sudden my email pinged, and it was Dr. Smith. And I read the email, and he said, "Thanks for everything you did. All my claims are off hold. They're all
nice.
released." So all of a sudden he's got revenue coming in. And I emailed him back and I said, "Well, Dr. Smith, honestly, I hadn't gotten as far as finding out what the problem was." And he said, "I don't care, it's fixed." And do you know that he answered every query that day? And to this day, he has less than a 24-hour turnaround on answering our clarifications.
Oh, wow.
Yes.
That's big impact.
Big impact, definitely.
Big impact. So I think I appreciate that story. How do you, as the regional manager, instill that in your team, right? Into ensuring that we help remove barriers where we can and continue the important work that you're doing?
I think the biggest key is understanding that listening is not just hearing, it's active listening. Our agenda may not be, it may be first in our minds, it may not be first in everybody else's minds. So many times we need to step back, find out what their priorities are. And if it's something we can help them with to clear it off their plate so they can listen to us, then we need to do that.
Absolutely. It's really interesting to hear you say about kind of that teamwork, all for one, one for all mentality that we have here. Do you stress in your area about the relationships within Ensemble that's really important?
Absolutely, because being the middleman between the documentation and coding, we work very closely with coding. We need to establish that trust and respect with them, and we need to provide them the same as well. Because they can't do their job without us, we can't do our job without them. So we are really bonded. We work very closely together, and we need to keep the "we are Ensemble" mentality.
Absolutely. So you've been in this work for how many years?
I've been doing CDI for only about a year and a half, but I did compliance and auditing for years.
Okay, so in that comes a rich history of clinical experience,
Yes.
revenue cycle experience. For those folks maybe who are watching this that doesn't know anything about Ensemble, who we are, or what we do, what would you say is the reason why you're here and that you do this work?
Oh, that is so easy. The culture.
Oh, good.
The culture here. It's not just me. I am part of a team, and every day I'm reminded that I am part of a team, that what I do matters. It matters with the physicians, it matters with the patients. The last thing a patient wants is to go home after a horrible hospitalization and get a bill. We need to make sure we do it right. We are doing it for not just ourselves, but for everybody involved.
Great, thank you. All right, so we're gonna wrap up, and I'm gonna give you a question, a random question, so people can learn a little bit about you. If you had access to a giant billboard and could put any message that you wanted to anyone reading, what would that message say?
I think after 2020, the message would say celebrate. Celebrate everything, because 2020 really showed us that it's not always what you think it is. So take time to appreciate it and celebrate it.
Great. Thank you so much for being here. I appreciate your time today.
Thank you, Julie.
Be on the lookout for more operator insights.